Well, back in October of last year, President Trump declared the opioid crisis a public health emergency, with drug overdose rates totaling 72,000 in 2017 alone. That's according to the Centers for Disease Control. Of those, 49,000 were estimated to have been caused by opioid abuse. But opioids aren't the only thing being overprescribed. Sara Montes takes a look at the dangerous overuse of antibiotics.
Antibiotic-resistant bacteria has become a major problem in the U.S., resulting in thousands of deaths each year. Now, what's causing this problem? Well, according to a recent study published in the Journal of the American Medical Association, doctors are unnecessarily prescribing antibiotics to patients in hospitals and urgent care. The study looked at 156 million patient visits to urgent care centers, retail clinics, hospital emergency rooms, and doctors' offices. From those visits, the study found that nearly half of the antibiotic prescriptions made to patients, or 46%, were unnecessary. Medical experts say this is an alarming trend that's only increasing a patient's risk of antibiotic-resistant infections, or superbugs, that can't be stopped with drugs. The results are especially important given that the number of urgent care centers has surged in recent years. According to the Urgent Care Association, urgent care centers grew to 8,125 centers in 2017. That's up 20% from 2016. So why are so many patients being prescribed an antibiotic they don't need? Simply put, experts say that part of the problem stems from the patients themselves demanding the drugs. And it's not just antibiotics that are being overprescribed. The recent opioid crisis in America has received so much publicity in the last few years. And just recently, a federal jury in Brooklyn convicted Dr. Martin Tesher, found guilty of illegally prescribing highly addictive oxycodone and fentanyl without legitimate medical purpose. And in another case in New York City, Dr. Lawrence Choi has been charged with manslaughter and other offenses for illegally writing prescriptions, 3 that resulted in deadly overdoses.
80% of people who develop an addiction to heroin report that they began their addiction with prescription pills. So if we are to get ahead of this problem, we must turn off this source of supply.
A doctor's office is a place where you go when ill, when you need medical help or advice. But in this case, Dr. Choi's office was a place you went to feed addiction.
Overprescribing medication has become such an epidemic that emergency responders are now starting to educate the public on overdose risks and life-saving procedures. Now, details of this study suggest that unnecessary antibiotic prescribing is much more serious than first thought. Right now, the Urgent Care Association, CDC, and experts in the medical industry are all trying to find ways to ensure antibiotic prescribing across the country is properly done. In Washington, Sara Montes, RT.
Hey YouTube, thanks for checking out our channel. We hope you enjoyed the video. We have tons of content for you just like this. For more of RT America's one-of-a-kind news and analysis, be sure to subscribe and never stop questioning more.